The genus Campylobacter also contains small gram-negative comma-shaped bacteria, but in contrast to something like Vibrio, Campylobacter are even smaller. They are very, very small. In fact, they will pass through a 0.45 micron filter, which for a long time people thought Campylobacter infections were caused by a virus because they couldn't capture them in that standard bacterial filter. They grow best with reduced oxygen and increased carbon dioxide at 42 degrees. So culturing them is a little bit trickier. Even though they will grow in our bodies at 37, when you try to grow them in culture, you have to alter the conditions a little bit. This is not terribly common when working with bacteria. Usually if you're working with bacteria, one that grows inside the human body will do fine at body temperature for incubation, but these like it hotter. Instead of LPS, just like Neisseria, they have LOS, the lipo-oligosaccharide. So that carbohydrate component of the LPS is smaller, so it's LOS. They do have a capsule, which helps with adhesion and immune evasion. Their small size allows that they can be recovered from the stool, but remember, if you want to filter the stool to collect the bacterium, you would have to use, I believe the next size filter is a 0.22 nanometer filter. They were so small, again, they were thought to be viral. The species associated with human disease are listed here. The most common one that we do see in people is Campylobacter jejuni. These are bacteria that are most often found in animals, especially animals relevant to agriculture, poultry, cattle, sheep, and pigs. In humans, the majority of infections that we're going to see are gastrointestinal, but there can be other effects as well, and we'll talk a little bit about those as we go through these slides. When ingesting a contaminated food product, the majority of the bacteria are killed by stomach acid. So it requires a rather high inoculum to make a patient sick. The capsule can also be protective. They have various virulence factors, including adhesins, toxins, and cytotoxic enzymes. But the trick is that the exact contribution of each of these virulence factors to the disease is still unknown, because even strains that lack these virulence factors are still virulent. So it's hard to figure out what something is doing when a strain without that thing can still cause disease. The species Campylobacter fetus is most likely to spread from the GI tract, and that's because they have a protein called the S protein that helps to protect them from being killed by complement if they try to escape the intestines. Campylobacter infections are almost always zoonotic infections. They were originally in an animal, and you acquired the infection through contaminated food, milk, or water. And by contaminated, I mean contaminated with animal feces. Campylobacter jejuni, really highly associated with poultry. Poultry is estimated to have caused 50% of Campylobacter jejuni infections. It's hard to get an exact number of Campylobacter infections per year because for the most part it's a self-limiting gastroenteritis, and so if patients don't seek treatment, it's hard to diagnose what they've got. But the estimate is anywhere from 1.4 to 2 million cases per year in the US. Most commonly, the disease is seen in infants because infants tend to just get sick more easily. They don't have necessarily the same stomach pH as an adult, and they certainly don't have as robust an immune system. The next age group is between the ages of 20 and 40. Again, in this case, you would think like you're the healthiest. That's part of it, but also part of it is that between the ages of 20 and 40, people tend to become more adventurous eaters, and they're more likely to prefer undercooked steaks, perhaps raw dairy and cheese, so more likely to be exposed to the infection. And then it can be associated with animals. Unfortunately, puppies were to blame for a drug-resistant infection in 118 people in 18 states. I think this was associated with a chain of pet stores. Most patients who have a Campylobacter infection will get GI infections, and that can be 10 or more bowel movements per day. So very uncomfortable, definitely will interfere with your day-to-day life. The diarrhea can be bloody, and this would be because of lesions that the bacteria can form in the intestines. Remember, it does produce enterotoxin. Generally, enterotoxins are going to be what causes diarrhea. They either lead to hypersecretion of fluid or malabsorption of fluid. And then the bacterium also has some cytotoxic enzymes, which can probably cause tissue destruction. Again, we don't know a lot about what all the virulence factors do, but that's a pretty good assumption. And these infections, as I mentioned before, are usually self-limiting. Now, one thing I'm going to have you research as part of your reflection for this week is that Campylobacter infections are sometimes associated with an autoimmune manifestation called Guillain-Barré syndrome. And so I want you to think about why. And some Campylobacter infections can also be associated with a type of reactive arthritis. So you should be able to do a quick Google search and come up with a couple of answers for why Campylobacter infections might be associated with these types of autoimmune responses. In this case study, there's a 74-year-old woman who developed Guillain-Barré after an episode of Campylobacter jejuni enteritis. After 1 week of fever, diarrhea, nausea, pain, weakness, fatigue, the patient's speech was noted to be severely slurred. She was taken to the hospital, where it was noted she was unable to speak, although she was oriented and able to write coherently. So that ruled out a stroke. Sometimes when patients develop slurred speech, that could be because of something like a stroke, but she had no other neurological symptoms. She ended up having some numbness around the mouth, bilateral ptosis, that's a lazy eye, so where the eyelid kind of doesn't close all the way or open all the way, and some facial weakness. And then she eventually started to develop muscle weakness in her arms and chest. So now she's having more significant neurological complications. But again, because she was able to write and wasn't disoriented, they weren't considering really a stroke. But on the third day, her mental status remained normal, but she could only move her thumb and could not lift her legs. Sensation to light touch was normal, but her deep reflexes were absent. Campylobacter was recovered from the stool that was collected at the time of admission, and a clinical diagnosis of Guillain-Barré syndrome was made. Despite aggressive medical treatment, the patient had significant neurological defects. After 3 months, discharged to a rehabilitation facility. This woman illustrates one of the significant complications of Campylobacter enteritis. So again, I think it'll be important for you to look up the association between Campylobacter and Guillain-Barré, because Campylobacter is a relatively common foodborne illness in the US, and this is a potential complication for your patients. The bacterium can be diagnosed through microscopy, particularly of a stool sample, immunoassay or PCR. Culture is difficult historically because of the low oxygen requirements and the higher temperature. So you have to have a specialized incubator, basically, that is a low oxygen incubator that provides the CO2 necessary and is also set at a higher temperature. So it would almost have to be like a specialized Campylobacter incubator rather than one of your regular incubators. It's also slower growing. It can take 48 hours or more for colonies to show up on a plate. There's no vaccine. However, antibiotic therapy can be helpful if you know it's Campylobacter. And one of the challenges, though, with that antibiotic therapy is that most strains are resistant to penicillins, cephalosporins, and sulfonamides. So it can be important to identify that you're dealing with Campylobacter so you know which drugs are not going to work. Really key in preventing Campylobacter infections is proper food preparation. Cook your food. When you go out to eat, make sure your food's cooked. That goes a long way to preventing infection. Drug-resistant Campylobacter infections are considered a serious threat by the CDC. Over 400,000 cases estimated per year, leading to about 70 deaths. But these are bacteria that can cause diarrhea, fever, abdominal cramping, and sometimes complications such as irritable bowel, temporary paralysis, which is associated with that Guillain-Barré, and arthritis. So even though it's not one that you might have heard of really commonly, it is a common infection, and it is becoming more serious in the US with that drug resistance we're starting to see.